we felt that it was important to create this panel to look at some of the positive aspects of the pandemic and what it has revealed to us about the way that we live our lives and what can be done differently in the future. This is an important issue to discuss on Peace Day. It's going to take all of us to reduce violence by 50% as per Goal 16. And we have demonstrated through COVID that we can work together.
Thank you. Well, we are honored to have with us leading the discussion, Michelle Noom, who is President and CEO of CARE USA.
And joining her is Dr. Robert Redfield, Director of the CDC, the Center for Disease Control and Prevention.
Trudy Lang, Director of the Global Health Network, Nuffield Department of Medicine, University of Oxford.
Founder and Executive Director of Accord, Dr. Vasu Gundan.
And Roberto Marquez, Co-Chairman and Group CEO of Global Personal Care Cosmetic Group Natura & Co., present in 73 countries and well known for its rapid and effective response to the COVID-19 pandemic. Panelists, thank you for joining us. Michelle Noom, over to you.
Hello, I'm Michelle Nunn. I'm the CEO of CARE USA, and I am really happy to be with you all on this Peace Day. So happy Peace Day, and really grateful to have the opportunity to moderate the session on viruses and the impact on peace and sustainability, a question that I know that we are all grappling with and really confronting in a very powerful way at this moment. And we have an extraordinary assemblage of people to engage on the questions around how we are tackling this, what the implications are, and informing and inspiring, engaging all of you. As I said, I work with CARE USA. CARE is an international organization. We started 75 years ago in the aftermath of World War II, when a small group of Americans said, we're not going to stand on the sidelines and let people face starvation. And they invented the world's first care packages. The idea of sending a care package to somebody at college or your kid at camp actually comes from the organization CARE. CARE now works in 100 different countries, and our mission is to defeat poverty and to save lives and to achieve social justice. So you can see why the issue of peace and the sustainability and the sustainable development goals are at the heart of our work. We center our work around women and girls, and we know that that we cannot defeat poverty until all people have the opportunity for equality. In the wake of COVID, we have stood up our response in 69 plus countries. We've reached over 19 million people directly. That means we've been building water stations, 25,000 plus water stations. We've provided food and support through cash assistance for 500,000 people and millions more in terms of absolute support on the issue of hunger. So there is so much for us all to do. And it's why I think this opportunity to come together and to learn together and to rally together is so important. And so we know, again, that the COVID-19 virus has had enormous impacts. The Gates Foundation came out with a report last week, usually quite an optimistic report that they do on the eve of UNGA, of this opportunity for people to come together in the UN. And they said that we, in the last 25 weeks, have lost over 25 years of progress on issues of indicators of poverty, of hunger, of health. So we can and must make that up. And it's, again, why we have a group of extraordinary experts today. We have a real privilege because we're going to hear from Dr. Tedros, and many of you all will know he's the Director General of the World Health Organization, and he has a short video where I think he frames the conversation and the issues that are before us. So we'll start with that.
The COVID-19 pandemic has left no country untouched. This is so much more than a health crisis. The pandemic has caused social, economic, and political instability, the effects of which will be felt for many years to come. It has increased violence in families, behind closed doors. The virus has brought nations together in solidarity, but it has also exposed and exploited geopolitical fault lines. We have seen how this invisible virus can foster fear and mistrust, fuel division, and undermine peace. It illustrates that health and peace are interdependent. Equitable health services strengthen community trust, which in turn contributes to strengthening health systems and peace-building efforts. We must never forget that we're one humanity. We share the same planet. We share the same DNA. We share the same hopes and dreams. Now, more than ever, we need more international cooperation, not less. Last century, the horrors of 2 world wars gave birth to the realization that international cooperation is preferable to international conflict. My hope is that the defining crisis of our age will likewise remind all people that the best way forward, the only way forward, is together, by focusing on what works. We will never live in a perfect world, but we can live in a healthier, safer, fairer, and more sustainable world. The choice is ours. In peace and solidarity, I thank you.
So I think Dr. Tedros well laid out the interdependence that we all have, and that we can't get through this without working together around solutions that work. Also the interdependence between health and issues of poverty and issues of peace. And so I'm really pleased to have the opportunity to explore some of those themes that he so well laid out with us, with a group of extraordinary experts and an amazing panel. So let's start with them. And we may have a few folks that join us along the way. They are doing immediate and emergency sort of things in many situations, which I think you all will all understand. But I'm going to ask that we go ahead and introduce the panelists. And I'm going to, throughout the questions, ask them to tease out a little bit more about their experiences and backgrounds. But let me start with, we have Professor Trudy Lang, who is with the University of Oxford's Global Health Network. She is leading the way in that extraordinary work. We have Roberto Marquez, who's the executive chairman and group CEO of Natura and Company, which has some amazing brands that you all will all be very familiar with, and I hope that he'll touch upon. And then we have Dr. Anita Bhatia, who is the deputy executive director for resource management, sustainability, and partnership at UN Women. So thank you all so much for joining us. And let's start with setting the scene a bit around the implications of a virus and pandemics and health on peace. Maybe I'll start with you, Trudy, Dr. Lang. If you would just maybe talk a little bit about what you're seeing in the world. You also have a history of working with viruses and seeing the implications. But it would be helpful, I think, just to sort of get a sense of what are the downstream implications of these viruses, especially a global pandemic, as it relates to the kind of cleavages that Dr. Tedros talked to us about.
Thank you. And thank you very much for inviting me to join International Peace Day. It's really exciting to be part of this. And I think the approach that International Peace Day has taken this year to bring in this section on the impact of viruses and think about health, as we've heard, as being a really key factor in sustainability and equity across the world. So I well done to Peace One Day organisers for adding this topic into this whole activities today. So I've been working in antiviral research for over 25 years. I actually work in tropical medicine and global health, and infectious diseases are the kind of cornerstone of our work, because they still cause the greatest mortality across the world, particularly in under 5s, and absolutely a difference in disparity in who's affected most of these infectious diseases, in terms of by far the biggest burden of disease are in the poorest populations. So I spent my career working on things like malaria, HIV, TB, and also things like worm infections and just the things that cause the everyday problems in the most poorest communities around the world. And in the past decade or so, we've obviously all been exposed to the realities of pandemics with COVID now, but I was also very involved with the Ebola outbreak and also working on Zika. And so what I'm hoping to talk to you all about this afternoon brings in our experiences from all of those diseases. But it comes down to exactly as Tedros was just saying, that this is around thinking of this as a global issue. Viruses don't know about any political or geographical boundaries, and yet the impacts of diseases like COVID, same with Ebola, Zika, malaria, TB, all of these I've described are exactly the same to everybody, but the impact is greater in the most poorest people across the world, and we have to keep that in mind. So I hope as we develop this conversation today, I can bring in some experiences I've had in working in communities like this, talk about how we need to work together more, as Tedros outlined to us, and give you some really positive examples of how that's happening with COVID, and definitely the lessons that we learned with Zika and Ebola in the past. So that's probably enough for now. Let's just go around the group and see if we can come back to any of those points. Thank you.
Thank you. Thank you. So we do see how viruses and, as you say, often the infectious diseases have a disproportionate impact on those who are already marginalized, and they also have a way of, I think, of highlighting our inequities, and we see that within countries, and we see that globally, and so and those do tear apart on the cleavages that already might divide us, geopolitical, and again within divisions. So Anita, I would love for you to speak to what you are seeing around the world through the UN system, and with perhaps a specific lens around the implications for women who we know are inequitably affected by a virus like COVID.
Thanks, Michelle. And first, let me just say it's such a pleasure to be with all of you on this really important, to discuss this really important topic today. I don't think it could come at a better time. And so congratulations, first and foremost, for teeing up this important discussion. Let me start by just saying that, I think all of us know that 2020 was going to be a landmark year for the women's rights movement and for gender equality, because it was the year that we were going to celebrate 25 years of progress on the Beijing platform, where Hillary Clinton famously said, women's rights are human rights and human rights are women's rights. And so that was what we were thinking about as this year opened. But then the pandemic hit, and of course, all celebrations came to a stop. But our review of progress did not. And in that review that is really country level based, we get, as UN Women, we are in we have the honor and the privilege of working with countries all over the world, all member states of the UN, to understand how much progress they have made or were making on the 12 areas of action in the Beijing platform, which cover a range of women's rights. Everything from ending violence against women to women's economic empowerment to women's leadership. And one of the unnerving and I think disturbing things that came out of the review that we did of 167 countries' reports was that while there's been quite a lot of progress on issues like access to health services, educational opportunities, improvements in maternal mortality, the overall situation of women actually hasn't moved and improved as much as one would have expected. And so we were already looking at a situation where we were going to be making urgent calls for accelerated action to change what we saw as the issue of insufficient progress. And we'd already been seeing before the pandemic that there was a big pushback on women's rights, what the Secretary General called the need for a pushback against the pushback, because in a lot of countries now you have governments who are frankly opposed to women's rights. And then the pandemic hit and it has just multiplied. It has just exponentially multiplied the negative impacts on women. And actually those negative impacts, to think about them, we can think about them in three ways. One, the impact on women's income. Second, the impact on women's health. And third, the impact on women's security. And the reason I mention these three is because when you look at the sectors that have been most hit by the pandemic, many of them are sectors which were heavily feminized anyway, and where female labor force participation is higher than male labor force participation. So you look at sectors like retail, hospitality, tourism, domestic work, garment industries, these are very high proportion of women working in them. Then you look at the impact of the fact that informal sectors in many countries have just ballooned because women have fallen back into poverty, even those who were just struggling out of poverty. Then you look at the fact that most frontline workers actually are women. And while we know that most deaths, at least in the initial stages, were of men, the fact is the greatest exposure in terms of infection is really to women. And then I have to mention the issue of care and the unpaid care burden, because even before the pandemic, we knew that women were carrying about 3 times the burden of care that men do in taking care of elderly, diseased children. And then with the pandemic, we've seen firsthand how women have had to carry even more of the care burden. And lastly, I must say a word about women's security and safety, because look, we knew before the pandemic that violence against women is a huge issue, and we actually think it rises to the level of a public health crisis. And during the pandemic, we have seen governments come out, right, and acknowledge for the first time that they've had to intervene in a big way to take care of the fact that so many women were being impacted by violence. So these multiple intersecting issues of income, health, and security have really driven what is happening right now, which is a big regression in the rights of women globally.
Yeah, it's a very sobering picture, and we do see, I think, the extraordinary secondary pandemics, as you say, domestic violence, gender-based violence, and again, the disproportionate impact of this virus on those who are already marginalized, and in so many places that is women around the world. So thank you for so well articulating that and helping us see that. So maybe Roberto, I will go to you. You come from a different perspective. You're leading a company, private sector, but you have employees around the world and also supply chains. I wonder if you could speak to what you've been seeing and reflecting upon as it relates to the impact of this pandemic. You also have a set of brands and a company that is very focused on social responsibility, social justice. So I think it will be really helpful to hear your reflections here.
Thank you, Michelle, and hello, everybody. It's great to be joining such an important discussion on this very important day that we reflect on peace, celebrate Peace Day. And we would say that probably more than ever, it's so critical that we hear everything that has already been said and really reflect in terms of what kind of world we want to build back coming out of this pandemic. There is no question about it that it's an unprecedented time for all of us. And it's such an important moment, I would say, that we come together, as Dr. Tedros spoke so correctly, in a very collaborative way. And we try to really walk the talk at Natura & Co. We have 4 amazing brands, as Michelle said, from Natura, the business that was founded and headquartered in Brazil, Aesop from Australia, the Body Shop in UK, and Avon, which is a very global business. Interesting to notice that, out of 40,000 associates, over 6 million entrepreneurs, over 3,000 stores in maybe 100 countries. The vast majority, I would say more than 80% of our network are women. And it's so important to really talk about some of those critical issues that we're seeing, throughout this crisis. One of them that has already been highlighted is the domestic violence. we've been seeing in many, many countries that we actually participate and have the privilege to be part of the communities, an increase of 2-3 folds in domestic violence. And so we, for the first time, even though we absolutely respect each individual brands and they have autonomy, and we like to say autonomy with interdependency, they, for the first time, came together on a campaign called Isolated But Not Alone, where we try really to support a lot of non-government organizations that do such an important work of supporting those women. And we donated $1 million from the Avon Foundation to those 50 frontliners organizations. And the work that they do is so critical. And again, it's even more critical as we go through this crisis, because not only there is this impact on health, lives and livelihoods impacted by the pandemic, but the unintended consequences, both economic but also social, that we are seeing in the world is so critical. And it is important for the private sector, working together with government, working together with civil society, to actually think about what kind of world and how can we really reshape this direction. The direction it is going, it's not very exciting, and it's creating all those issues that some of the panelists already articulated. But we are still very optimistic that coming together in events like today, coming together through the United Nations, there is a way for a more multilateral approach, where companies, civil society, government, even if they don't have all the answers, trying to come together and trying to really focus on those crucial issues that we're seeing. So for us at Natura & Co, this is just part of doing business, because at the end, I also believe that we heard about the link on health and peace, and I also would add sustainability as part of this interdependency and connectivity, because at the end, we also cannot run a business in a dead planet. So very important to, I think, reflect on a day like today on those very important issues and how we can help each other to find, the proper answers and solutions.
Thank you, Roberto. Very well put. And I do think that calling out sustainability is so inextricably tied to these issues. And I think many of the themes that will be discussed throughout the conversation through this extraordinary Peace One Day. So maybe just before we go, I'm going to turn a little bit to what are we seeing that is hopeful about the way that we are responding, and how are we building upon that? But before we do, I guess, Trudy, I would love to hear from you, given your history and experience. Are there lessons from history, from other viruses that we have fought together collectively, and also what we've seen? Like, what are some of the implications from history that we can learn and take forward?
Yeah, thank you. And what a great privilege to be with this group, because I think between us, we all come from very different sectors, but this is such a good way to bring us together. Yeah, I think what we've learned from other viruses and other outbreaks and history is that, well, firstly, just to be slightly negative about it, there will be another. We'll be in the situation of another pandemic, but also that these populations we've all been talking about live with viruses every single day. And the largest causes of under 5 mortality across the globe in impoverished situations are viral infections, and also other parasitical diseases that are largely preventable. So what we've learned, and I think what's a really positive outcome as well from COVID, is that we need to share how to tackle these things and do more research and empower the communities. And what I really liked about hearing, especially about bringing women in, is I spend a lot of my time trying to work with midwives, nurses, healthcare workers, because in most of these settings, we don't have doctors, and many people don't even ever make it to a hospital, and they never even have a diagnosis for the infection they have. So we rely on the frontline healthcare workers to carry the burden of most of these viral infections. In an outbreak or an everyday disease such as lower respiratory infections. And we work really hard to try and take new skills and understanding and knowledge to these nurses, midwives, frontline healthcare workers, and give them the attention that's often more skewed towards senior clinicians or people far away in capital cities, and try and bring equity to who benefits from research. Because unless we do more research, we don't understand what the priorities are. We don't understand what could be put in place to change these things. And also, we have to work with the community and from the community. And so community engagement, education, empowering these workers. And this is so often women. So that's a really positive message, I think. And eventually, the only way we got through with Ebola and then again with Zika, and I'm sure this is definitely now, we're seeing it now with COVID, and learning to live with it because COVID is now endemic, is that we have to do good public health messaging. We have to gain community trust. And that is by working with everybody, and a lot of focus on education, training, sharing resources and sharing tools. And I think they're the most powerful lessons that have come through all of our previous experiences, and we're definitely putting into play now for COVID, but also for the future pandemics and outbreaks that we will be sadly experiencing.
Yeah. Well, it's such an important reminder for us to think about how we prepare now and are building a more sustainable future and a stronger health infrastructure for the future, because we do know that we will face challenges. And again, we will have another virus, we will have another outbreak, but hopefully we will have learned really critical and important lessons that we can carry with us that will make it less devastating, and enable us to respond with greater strength and solidarity around the world. I really do note that so much of the response does lie in the hands of frontline community health workers. And often we focus on the vaccine and some of the technological dimensions of this were critically important, but we also need to recognize, I was in a gathering yesterday where a group of folks that lead around water and sanitation were saying the very best personal protective gear is clean water, as a starting point. And that's true for so many diseases and viruses. So I think this focus on how are we building back as we move into the future with stronger infrastructure and stronger emphasis on those that are leading the way every day, not only with this virus, but in the terms of the care of communities and families in so many different dimensions. So maybe building upon that, Trudy, your comments, thinking about what are some of the creative, hopeful partnerships, collaborations, creative ways of responding that we can build upon. One of the Sustainable Development Goals is focused around partnerships, Sustainable Development Goal 17. And so how are you seeing those kinds of partnerships and collaborations come into play? And how might that charge us? As you said, Anita, some of these challenges have been with us way before COVID, but this is an opportunity to perhaps take the veil down and to see some of the disparities and to act with a different kind of urgency and transformational possibility. So maybe you can speak, Anita, to what you see that is hopeful in the response.
Yes, thanks, Michelle. And I think the pandemic is like this giant flashlight, which has just shone a light on some very deep existing structural inequities. And so I think this is too large a problem to be solved alone, and it does require partnerships. However, I do think that the zeitgeist has really shifted the discussion on the fundamental role of public policy and the role of governments. If anything, this has shown that governments have an absolutely fundamental role, both in terms of the initial investments in the public health systems that they need to be making, but also in terms of showing adherence to science, of building trust in their communities by taking a fact-based approach to the problem, and by being crystal clear about the rules that are needed to be put in place for us to manage our way out of these crises. So I think the role of government cannot be overstated, particularly because governments today, most of the governments in the developing world today, are looking at the face of an impending major debt crisis. So actually part of our work at the UN, as we have thought about what elements are needed to build back better, is to say to governments that building back better requires building back greener, but also this gender lens. So one very specific partnership that I think we have to work on is making sure that everybody's voices are raised on this issue of ensuring a gender lens in the fiscal stimulus packages, because that's what governments are thinking about today. How do we spend that money? And our job as stakeholders in all of this is to make sure that as they think through those public policy interventions, that they are making cash transfers unconditional, that they are targeting social safety net solutions to women, that they are investing in digital ID systems that allow women in informal sectors to be found, and that they are actually making disproportionate investments now in public health systems and infrastructure to reach people. But I also want to congratulate Roberto for what Natura is doing, because I think those are exactly the kinds of investments and approaches that we need to see in the private sector. Roberto, we know the work that you're doing through the Avon Foundation, and we applaud it. We work closely with them because, frankly, we need all voices at the table, right? So we need governments, we need the private sector, in the ways that Roberto outlined, but we also need, and this is really, really critical, is we need the voice of civil society. We need women's rights movements to be supported, because if they get decimated, there is nobody to ground truth and tell you what is really happening on the ground. The reason we have the data on domestic violence that we were referring to earlier is because women's rights and women's movements all over the world were lobbying for getting this information out and were pushing for shelters to be treated as essential services and forcing policymakers to pay attention. One last point, and that concerns having women at the table. So again, when we talk about partnerships and what can work, I think a partnership that really pushes for having the voice of women at the table is essential. It's astonishing to me how often you turn on the television and you look at who's talking about the pandemic, the virus, the public policy response. They're all men. And we've seen already that in countries where women are at the helm, which is not to say that there aren't enlightened male leaders. Of course there are. But there does seem to be some, not causation, but at least correlation between the presence of female leadership and better outcomes. And I do want to just say one last thing, if I may, Michelle, and that is UN Women, has launched this campaign called Generation Equality. And Generation Equality is a way to bring together public sector, private sector, civil society, think tanks, academics. We're going to be having 2 fora next year, but what's really important is that Generation Equality is a way to bring a laser sharp focus on some of the key issues that have emerged, that had existed before, but have just been amplified in the pandemic. So I just want to invite everybody who's watching to reach out to UN Women to join Generation Equality. Thanks, Michelle.
Thanks. Well, I think there's never been a greater example of the importance of people coming together. And I think that means making sure that we have equitable distribution of leadership around the table, and also that we have true international cooperation, that we have science-led governmental response, and that we have multi-sector response, because I don't think we can get through this without that. And so, Roberta, maybe I'll turn it to you to talk a little bit about what you've seen from the private sector response. I will just say, from a care perspective, almost half of our early response in the first few months was supported and resourced by our corporate partners. I think they did see the global importance, and they saw some of the global consequences, the importance of responding internationally. So I would love to hear from you about what you're seeing in terms of those multi-sector partners.
Yeah, no. Listen, this is so important, right? I think we've been talking today, and it's always a great reminder to all of us how things are interconnected, right? So the pandemic is a health crisis. but at the same time, it also touches a lot of the issues about exacerbating inequality. And then it touches a lot of issues regarding human rights and sometimes gender issues, as we were talking about domestic violence and all the other aspects. So it is important that the response that we see from the world is also interconnected, meaning getting the expertise from all different sectors, government, social, civil society, academia, right? The science, you know, we needed to listen to the science here, right? And we needed to make sure that we respond based on data and science versus just opinion that sometimes are opinions that are very biased for one way or the other. So I think if we embrace this multilateral approach of this partnership and collaboration, I'm very optimistic that we'll find the right solutions and we'll be able to really revert some of the trends that, as we heard today, are not the most exciting ones. But we have the resources. That's the other thing. Between government and private sector, you know, we have a lot of resources. And if we can funnel to use the right way, and if we have this idea that we can actually combine economic development and sustainable development, if we can combine, you know, economic development in a more just world, in a more equitable world, I think we're going to really rebuild back better. And that's, for me, is a call to action. As one person that represents a private sector on an amazing organization that embraces that, I think the call to action is for all the other sectors, and especially in the private one, to connect with events like today, to try to get involved and engaged in order to really help framing this properly, and then helping to find, you know, the right answers and the right solutions.
Thank you. And I think that we've had Dr. Robert Redfield join us. Dr. Redfield, we're really grateful to you for the opportunity to speak to you. Dr. Redfield is the director of the U.S. Center for Disease Control and Prevention, and so has been hard at work over the last months. And so, Dr. Redfield, we've begun by giving a little bit of a grounding around the sobering reality of what we face and its implications on peace and sustainability. And we are talking now about partnerships, collaboration, and what is going to be required for us to build back a more just world and a stronger world with greater health outcomes. So maybe I'll just invite you to make up for lost time and to jump in and to give your brief perspective on what we face and how we can take heart in building out some of the creative ways that we're seeing hope.
Well, thank you very much, Michelle. It's great to be with you all today. I think we all recognize the current pandemic for what it is. I mean, it is the greatest public health crisis our world has faced in over a century. And I think we all have to recognize this is a challenge that we are going to be engaged in for some time. You know, as we look at it on a global scale, I'm sure we'll be confronting this pandemic for several years in the future. One of the things that I would say that's so important that I think has been hard to find as we take on this global challenge, never underestimate the importance of unity. This really, this is a time for both in my own country for people to come together and to confront this pandemic with the energy that they have, and I would argue on a global scale that we all come together and use our God-given talents to confront this pandemic and keep.
I have lost Dr. Redfield. Have others also lost Dr. Redfield? Okay. All right. Well, we'll try and return to him, but I think his call for unity and coming together is a really important clarion call that we can carry forward. I mean, in that spirit, I think one of the last questions that I had was to see if we could do a call to action, so to speak. You have an audience of everyone, I think, from students to academics to activists, and we'd love to hear a call to action. So Dr. Redfield, I think you're back, which is terrific. We'll let you continue, and then I was just asking the panel that we'll think of maybe a 30 or 45 second call to action at the end. So please continue.
Well, I just wanted to say that the importance of unity. The second thing I wanted to say that, of course, partnership is central to an effective response to any big public health challenge. A couple comments that I wanted to put out there is you got to see the possible. You can't underestimate the possible. You can't shoot low. You know, I think you and I, Michelle, share. I happen to believe that global health equity is an accomplishable. A lot of people look at me as if I'm sort of pie in the sky. But I do think that we need to begin the hard toil of moving one step at a time and recognize the social injustice that we have. I do believe, in my own view, it's one of the greatest ones is the health inequity we have in this nation. So we have to see the possible. We can't aim low. Examples that I use is, you know, who would have believed in 1983 a group of individuals, not public health people, not doctors, sitting around having dinner, decided, you know what we're going to do? We're going to get polio. At that time, we had over 300,000 cases of polio in 125 countries. They said, you know, we're going to get rid of polio, the Rotary International. And really, 5 years later, WHO, CDC, UNICEF joined. Later on, we had the partnership with the Gates Foundation and more recently IAVI with the goal of eliminating polio. And while it's a challenge, the reality is we're down to 2 countries. As you know, this year, Africa was determined to be free of wild-type polio. We have the challenges of getting rid of vaccine-associated polio outbreaks. But the reality is they didn't aim low. They saw the possible. They put partnerships together. We're in that. And I do believe that in the not too many years ahead, the nation will accomplish it, as you know, eliminate polio. I look at the partnerships that we put together when the health inequities that I personally saw, where my patients now were approaching living a natural lifetime in the United States. When I worked in sub-Saharan Africa and Malawi, I saw life expectancy fall near to 30 years of age. Enormous inequities with the inavailability of antiretroviral therapy, which back in 2002, when I began treating people in Africa, everyone said it wasn't possible, wasn't feasible, can't be done. Why are you putting up that maybe people could get treated? And now you see today that we have really over 20 million people on therapy between the PEPFAR program, the Global Fund, and all the partnerships that we have with the local health departments.
I think we may have lost Dr. Redfield, but he's given us a great history lesson that should make us hopeful and aspirational as we go forward and think about where and what we should be aiming for and keeping that bar really high around global health equity. I think that's an extraordinary call to action for all of us. So until he comes back, maybe I'll ask each of you to, oh, Dr. Redfield, you're back.
I'll be quick and finish. It sounds like it's a hard connection from the United States, although you're in Atlanta, aren't you?
I'm in Atlanta.
Michelle? Yeah, I guess you have better connections than we do up here. Anyhow, that was my point. The other one is the extraordinary partnerships that we have in our country right now between the private sector and government. Who would have believed, that we'd now be having 6 vaccines in advanced development, 3 in phase 3 trials. Clearly are on the verge of really being able to have vaccines available before the end of the year. That would never happen without a partnership between government, the private sector, the state, local, territorial health departments, the academic world, and obviously the community volunteering for these trials. Just to see that. I would probably close with a comment that but central to our ability to harvest these partnerships, is we really do have to invest in a long-term and a sustainable way in the core capability of public health. That is data analytics, laboratory resilience, public health workforce, and emergency response capability for the world. We need to be over-prepared for these pandemics, not under-prepared as we were in this situation. That I would argue that it's time to get the commitment to build the public health capacity, not only that the world needs, but the world deserves. And again, that's what I will keep pushing for. Those real two issues, the global health capacity that this world not only needs and it deserves, and the recognition that we need to keep moving forward, to reach the goal that I do believe will be reached at some point in the history of our world. That is that we have equity in health around the world.
Thank you, Dr. Redfield. That's, I think, as I said, that is an extraordinary bar to hold. And I think this is a time in which we should be really facing the realities of the inequities before us and really setting that bar so that we say this cannot stand and we need to build back in a different way. It will enable everyone to have the capacity for equitable health. So thank you. I think that's a wonderful call to action. Let me ask, Trudy, I'll ask you to build upon that in terms of the call to action to those who are listening. How can they be involved in this and what should they be activating for and advocating for? And we have 3 minutes in total, so I'll ask everybody to keep their answer to about 30 or 40 seconds.
Who do you want to go first?
Yeah, Trudy, could you? Yeah, perfect.
Fantastic. Robert, that was brilliant, and I think you echoed what we've said throughout this call. Really, to create that global equity in health, I think we need to empower frontline healthcare workers, share much better between organisations, diseases, roles, and really build that sense of a global challenge in fighting infectious diseases, so that we're prepared. Not just to tackle COVID, to tackle future pandemics, but the daily diseases of poverty that all these communities are working with. So sharing the how-to, collaborating between nations, organisations and disease would be my very practical way to make a difference on this.
Thank you. Roberto.
Yeah, no, thank you again for having me. And for me, it's about this notion of a partnership, really acting in a united way with a multilateral approach. I don't think we're going to have the answer from one sector or the other. We needed to follow the science. We needed to hear the experts, but we need to act with resources, which fortunately the world has a lot of resources, but how we funnel the right way, how we build those right partnerships to find the right solutions. And work in a very a collaborative way, in my mind, that's the right approach and the call to action.
Anita, thank you.
Thank you, Michelle, and thank you again for convening this panel. I would say, look, if we look around and just building on what Trudy said, you know, women are carrying the world on their shoulders in this crisis. So my call to action, joining all of you, would be to say, the public policy interventions, the private sector partnerships, the multi-stakeholder coalitions we need to do this collaboratively have to put women at the front and center of the work, because without that, we will not be able to build back better. We also have to take climate issues into consideration. So I would just re-echo the UN's call for building back better with both a sustainability and a gender lens. Thank you.
So maybe I'll just close us out by tying together Dr. Tedros and then Dr. Redfield's call for togetherness, for unity, for working and at the highest aspiration, and for taking this crisis and letting us see clearly what we can do to achieve peace and a sustainable future and an equitable future for everyone. So thank you all, and thanks to each of you for being on the front lines of this crisis, and for all the people that you represent. And happy Peace Day, and I hope that everyone feels both informed and inspired and engaged. Thanks, everybody.
Thank you so much. Thank you.
Wow, such an important discussion. Thank you so much to all the panelists. Thank you.
It was so interesting. Yeah, thank you.